Hi everyone, in this video we will be studying about deep cervical fascia and its layers. So in the diagram we can see there are three important layers of the deep cervical fascia. The first one we will be studying is investing fascia. Investing fascia is enclosing the trapezius and the sternocleidomastoid muscle. The trapezius at the back, this muscle and the sternocleidomastoid muscle. These are enclosed by the investing layer. Then also encloses salivary gland. The two glands are enclosed, the two anterior glands, that is parotid and the submandibular gland in this region. Okay. Then we have the pretracheal fascia. Pretracheal fascia encloses which gland? Pretracheal fascia encloses the thyroid gland and forms its false capsule. Then we have prevertebral fascia. Prevertebral fascia is most important point is cervical, and the prevertebral fascia will be in the front of the vertebra. This one, and it encloses the cervical, and the brachial plexus lies behind the prevertebral fascia. The cervical nerves and the brachial plexus nerves will be behind the prevertebral fascia. Okay, it will be merging from the cords, so it will be behind the prevertebral fascia. And then the subclavian artery and the brachial plexus, as it emerge from behind, they carry the prevertebral fascia downwards and laterally as axillary sheath. So which fascia is linked with the axillary sheath? The prevertebral layer. Okay. And then we have the carotid sheath. Carotid sheath is basically condensation of the deep cervical fascia around the common and internal carotid arteries, internal jugular vein and vagus nerve. Okay. Then the fusion of the layers forms the carotid sheath. And what are its contents? Common carotid artery below, and the internal carotid artery in the above region, then internal jugular vein and the vagus nerve. So these are the content of the carotid sheath. So we have done the three layers: investing layer, then investing layer was going back also, and then we had the pretracheal layer, which was enclosing thyroid gland, and prevertebral layer with the plexuses behind it. Okay. The next we will be dealing with is the carotid sheath. So carotid sheath contents we have already discussed. Then what is anterior to the carotid sheath and what is posterior to the carotid sheath? Anterior, A for anterior, A for answer cervicalis. And posteriorly we have the sympathetic trunk. Then at what level the carotid bifurcation occurs? This level also needs to be remembered. So it occurs at the level of C3 C4 vertebra. C3 C4 vertebra. So that's all about the deep cervical fascia. Thank you.